So here we want to strengthen and mobilize the knee after a surgery for a total knee replacement. And then also there's tension through the hip here, which we feel is from the hip flexors that's causing spasm and restriction of that hip joint in the front. First of all, for the knee, we want to loosen up the tissue to create more space in the tissue for healing. The space is going to allow for more blood flow. Okay, so having your legs straight here and just going to the forward bend. If there's a lot of tension in the back of the knee, just bend your knee this way. It'll allow you to loosen up tissue in the back. Okay? I hold my stretchers for quite long, depending on how stressed I am. The more stressed I am, the more tighter I am. That tightness comes from your nerves. When we get anxious, when we get stressed, we engage our nerves. That creates tension in the muscles. So the most important thing is learning to relax our nerves, have the muscles let go so that we can start bending further. And as the muscles let go, creating more space for blood flow to go in. That's going to help the healing. Okay? And the other thing is the connective tissue, the lining around your muscles. They can get tight and restricted and bind the tissue. So by stretching the fibers, it'll loosen up that envelope around the muscle. Loosen up that fascia, the connective tissue around it, okay? So holding your stretchers for a prolonged period of time, one, helps you reset your nerves. Gets you to relax, loosen your nerves, let the muscles let go. And it gives the time for stretching the tissue, the fibrous tissue, to let it loosen and restructure in a more less restricted fashion. All of that takes time. It doesn't happen in 20 seconds, which a lot of people instruct stretching, right? So my stretching is more focused on sort of the yin yoga aspects, as long as you can. Without causing pain, that causes you to tighten up. Once you feel discomfort and you feel that rigidity, it's time to stop. Okay, so hold this as long as you can. Once it gets uncomfortable, you can't relax anymore, slowly lower yourself down, bend to the side, if you will, and just lay on your back in Shavasana to let your body settle. Once it feels comfortable, you can start again. Another way of stretching the back of the knee is grabbing your toes and just pulling it upward like this. If you can't grab your toes, you can use a belt strap or a rope to kind of grab your knee and grab the pant leg here to pull you forward. Sometimes I'll lie underneath the dining table, use the dining table to hold my leg in place. Okay? That way, you can be more relaxed and not focus your efforts on holding yourself. Okay? Another way of stretching the back of the legs, also with the inside of the legs, is to let your legs hang up on the wall like this. That'll stretch the adductor muscles that can also cross into the back of the knee. Stretching the back of the leg here is really important to loosen up the tension on the knee. This, as you stretch these muscles a lot, they're going to get raw, and if I hold this for a long time, I can't even engage that muscle to pull my legs together. So I use my hands to slowly bend, help them together. I'm going to lie on the side here, let it settle, and as it allows me to, I'm going to lie on my back here to let it completely relax. When you want to loosen your tissue, you need to stretch it both ways. So for what I showed you in terms of the bending forward, legs on your back, it's all about stretching the backside. If you sit on the edge of your table or your sofa and lie back like this, allowing your legs to hang, it's going to allow you to stretch your front.
That's right, yeah.
Okay? Hanging off your sofa might be a little bit too aggressive, so what you can do is just put a bunch of pillows up under your pelvis and just have that little bit of elevation. And then you can keep pillowing up to create a greater arc. Okay? And that'll open up the front of the hip. To stretch the back of the leg a little bit stronger on one side compared to the other is to do a single leg hurdler stretch. You can emphasize on that. And again, you're just kind of relaxing and let yourself bend. More body torque on that. It's going to give it a little bit more of a pull. Again, it always goes to stretch as long as you can to feel a change. If you run into discomfort, stop, let it rest. Trouble with stretching a lot is that it creates looseness, which then can cause instability. Okay?
Say it again. Sorry.
If you stretch too much, it creates looseness.
Oh.
But that looseness can also become a problem in terms of creating instability. So as you stretch and loosen up, you need to strengthen to create the power to hold the knee straight. So I can use a strap like this, giving myself resistance to push my leg out. I want to make sure my second toe, my knee, and my hip is tractioning on a straight line so that I am not losing that control. So it's all about creating that control. Okay? And then now you can do it with two legs by standing in front of a wall. You can then work on supporting using a chair, okay, a stool or a bench, so you can control the amount of weight you put on the leg. And you want to try and drop as far as you can, because that descent creates mobility as well. If you can't come down this far, are you tighten the hamstrings? Are you tighten the knee? If you are, just continue doing this. It'll slowly agitate it to loosen up.
It's
And
good.
Yes. So long as you don't cause pain that you're fighting against. Okay? So you go down as far as you can. And again, just looking at the traction, the front of the hips, right above the knee, right above the second toe. And you want to be able to control that descent so that they all move in the same line. Okay? And coming down this way. And then equally pressing up without a lot of wobbly. You don't want the knees to go outside. You don't want the instep to lift. You don't want the knee to collapse. From a side view, you want to see that your knee does not push in front of your toes. You want to keep your knee behind the toe as you drop and slowly press back up. You get good with that, you go one leg.
Oh.
Okay, and then you slowly descend.
Wow.
And then you press back up. Okay, now the single leg, you can also use it if I'm trying to be creative here without using a lot of resistance, but just even pushing that chair away and pulling it back. Just working on control. If you have elastic bands, this is where Pilates becomes very helpful, because you have the reformer to give you that control. Another important piece to strengthening is when you go do a squat like this and press, the natural instincts to use a lot of quadriceps, the muscles in the front. You want to try and focus more on using the leg muscles in the back, focusing on the hip extension. And you can do that by lying on a bench, pushing your leg forward, and working on your leg extensions this way. This, by lying face down, will reflexively help you engage these muscles back here more than this one in the front. And that will help you so that when you're actually doing your leg presses here, I'm going to emphasize more on the back muscles to extend. Okay? So just going a little bit further in terms of your stretching, this is going to be more intense than using the wall lying on your back. Okay? But by going down here and then slowly working your way back up. Okay? Those movements, you teach those muscles to stretch. The main focus is to create elasticity. Emphasizing on the hip a little bit more, that tightness you're getting. Lying on your back here will help you open up the hips. And sitting on a stool and allowing yourself to sit in this position. It's just sitting with that muscle in the lengthened position, trying to habituate it to let go as opposed to getting bound up.
Here.
Okay?
Okay.
So the more you create this mobility and space in your muscles, the more you facilitate that blood flow. There's a little bit in terms of conditioning of the legs, then we got to work on the core, and we'll talk about that now.
Okay. Great. Yeah.
So I'll upload that onto